All right, let's go ahead and get started. So good morning, good afternoon, good evening, depending upon where you're calling in. Parkinson Disease Research Community webinar. And this is Stephen Friend speaking. Today, you are going to get a chance to hear some discussion on the mPower app-based study that we've been doing. We're going to give you some descriptions about researchers and how they qualify and how you'll be able to get access to the data. Then we're going to spend some time talking about the data itself and some of the things that we have done. And all of it is to lead up to a chance to form a community, to have a way where people may be able to work together on not just data, but the insights that they have. So Stephen Friend, that's me, and I'll be luckily joined by Megan, Brian, and Andrew. And you may see a picture taken about 5 minutes ago of us wearing our parasite ties. This is in honor of the Drazen editorial. And with that, I want to turn over to why we're doing this. Sage Bionetworks is a nonprofit organization based here in Seattle. And for the last 6+ years, we've been interested in seeing, are there new ways to allow people to work together, to share data insights, and also to bring in people who are not anointed experts, but people who may not have looked at various types of data. And for this project, you'll see a list of names of people who've been key in allowing this work to occur. In particular, what we're going to talk about here is how it is that if you can put data annotated in the correct ways, having the correct provenance, that can become a way to share data and insights, really a research community that enables secondary research. And so this project is one of several we've been working on, where our dream, our quest, is to promote an ecosystem where research is conducted for others to be able to consume. The particular one we're going to talk about today was part of a class of siblings just about a year ago that were launched by Apple in its research kit mHealth project. And this mPower project in Parkinson was one of those first 5. And it's worth noting that ResearchKit provides a framework for clinical studies. It allows a way to have consents and surveys, tasks, and passive data come together. It's also, importantly, a way where open code that's sitting behind those apps is able to be hosted on GitHub for reuse. And for these first 5 studies and some since then, Sage Bionetworks, almost like a neutral Switzerland, is acting as the repository for that data so that others can take a look at it. In terms of the specifics of what it is that is in the mPower app, think of it as 7 streams of data, 4 activity tasks, 3 surveys that are able to be generated by the participants, whether they have or they don't have mPower, at the frequency that they choose to do that. And incidentally, a real call out to Joel Kramer and Kate Posen at UCSF for the powerful work they did into making sure we had a memory test as part of that. Behind the surveys and structured activities is a goal that we have to be able to follow certain symptoms of Parkinson disease, such as motor initiation, gait balance, looking at hypophonia, quality of the voice, and memory. And for each of those symptoms that might be assessed by a neurologist in their office, we've built in surveys, things that traditionally would be used, like the UPDRS, structured activities that are a way to assess those in real time, and for gait and balance and motor initiation, also put in passive measures that can have that data collected on. I'm looking at a more granular level at the components and the data feeds, because that's what actually is the type of data we're making available on Synapse for this project. You can see that for the walking, standing, and turning, there are specific data feeds that we provide, and similarly for voice and tapping and the memory gain. And it is the combination of knowing those components and the data feeds and features that allow people to make insights. Last week, March 3rd, we chose to make available the first 6 months of data. So the release of mPower data on March 3rd, and there are 3 papers that you can look to. One in Scientific Data showing you the specifics of where the data is and how you can look at it. An article in the Parkinson journal, NPG journal, talking about sort of impact on participants, on patients, and then an important editorial in Nature Biotech that came out that John Wilbanks put together, looking at the concept of qualified users, looking at consent. That's great. That could have gone out into the ether sphere, but what we really think is important is what we now want to go over, which is having such data consented in the correct way allows us to begin to build a learning community. Shown in the photos are some of the individuals who've been working with and advisors that have gotten us to where we are. And for mPower, and actually whether it's accelerometer data or other data, what our hope is to build a learning community where data and insights, not just by those who generated the data, are able to be shared and produce things that would be of benefit to the patients. And that project is taking place on a technology platform that we've built over the last 5 years called Synapse. My guess is many people on the call may not be aware of that structure, Synapse. And so I just thought it would help to look at this dozen or so communities that some of them for several years have been using Synapse as a place to go and get data, to have provenance, to have credit, and to be able to build new models of disease. And so with that, I'm going to turn it over to Megan.
Thank you, Stephen. I'm so thankful to be here today. My name is Meg Dorr. I'm a principal scientist of governance here at SAGE, and I just wanted to walk you through how we came to have this data. So first, we're incredibly thankful to all of our research participants. As you are probably well aware, mPower is an app available at the App Store, and participants download it and self-consent to this research study. As part of the self-consent, they decide about how they'd like their data used. So they have complete control of their data. We walk them through this shareable data process for qualified researchers, and then they get to self-designate whether they'd like to share their data broadly with researchers worldwide or just keep it here within SAGE. The research data that we released last week is the data that was designated by participants for broad sharing. And almost 75% of our participants designated their data for this broad sharing. So how do you gain access to it? There are 2 steps. First, you need to become a Synapse qualified researcher. We made this process as transparent as possible and self-reinforcing of research ethics best practice. So there's a number of different sub-steps to that, including profile verification on Synapse and linking to your org ID so that we're really creating an open community of researchers that research participants can learn about and learn from. We also wanted to make sure that we were reinforcing of these ethics best practices because participants are taking a risk in donating their data to us. We need to honor that gift and really make sure that we're using their data to the best of our ability to improve human health. The second step in accessing the data is joining the mPower research community. Researchers are asked to give a public statement of their intended data use and then also to publish their findings in open access publications so that research participants can learn from the research being done. Again, self-reinforcing, reinforcing that the donation is a tremendous gift to our community and reinforcing that the research that's being done is also a tremendous gift to the participants. If you'd like to learn more about how to access the data, I invite you to go to the mPower Public Researcher portal. You can see there on the wiki, accessing the mPower data. We'll walk you through a step-by-step process to gain access to the data. And with that, I'd like to introduce my colleague, Brian Bott, who's going to tell us a little bit more about the data itself.
Thanks, Meg. So I'm Brian Bod. I'm also a principal scientist here at Sage Bionetworks. So what you're looking at right now is if you go to www.synapse.org/mPower, this is the mPower Public Researcher portal. As you can see, important dates here include the webinar that we're on today. We will also archive all of the webinars that we have at this location as well. What I'd like to do is just sort of give you an overview of the contents of this portal and how to navigate it, as well as how to access some of the data that we're making available. So as Meg mentioned, if you look along the left, there are a series of sub-wikis that are available that provide additional information. The first of which is how to access the mPower data. So this will take you through step-by-step exactly how to become a Synapse qualified researcher and how to access the data. Additionally, we provide an overview of data descriptions of the 7 data streams that Stephen mentioned a little bit earlier that include 3 surveys as well as the 4 activities that are carried out: memory game, tapping, phonation, voice, and walking. And each one of those individual tasks has in-depth documentation, both about how the task is carried out on the phone, as well as the data structures that are made available through Synapse. But more importantly, and really why we're on this call today, is to start to build this larger Parkinson's mPower research community. And so we have a wiki page where we're trying to seed this community in Parkinson's research, and in particular, as Meg mentioned, make all of the intended data use statements for any Synapse qualified researcher available, not just to the researchers who are carrying out the work, but importantly also to the participants of the study, so that they can see exactly how their data is being used and in what capacity. So if we look at the tables tab, we have made available some sample data which has been okayed for more broad release, where you don't have to go through the qualified researcher process, such that you can see the types of activity data that is being collected through this study. And I'm going to step through just one of those, in particular, the sample walking data. So here is a screenshot of that table, and you can see the types of data that are included, a series of metadata about each task that is carried out, as well as JSON files that are available for different components of the task. In this case, readouts from the accelerometer and full device motion JSON readouts at 100 Hertz from the walking activity. And importantly, you can actually query into these tables to get more fine-grained, more interesting subsets of data, as opposed to looking at all of it. So an example of that would be, so instead of looking at everything for this particular table, you could look at only where the phone info column is iPhone 6. So if you're only interested in participants who have a particular set of metadata. And Synapse also provides programmatic clients such that you can run that exact same query and get that data, for instance, right in an R session, just as you are viewing it through the web. So with that, I'm going to hand it over to my colleague, Andrew Trister, who's going to talk a little bit about the early research results coming from mPower.
Thank you, Brian. I'm Andrew Trister. I'm a senior physician here at Sage, and I'm leading the efforts on the analysis for the data that have been extracted from mPower. And so far, what we have been focused on are 3 questions, but one of the aspects of building this community that we anticipate is having an area on that wiki page that Brian just went through, where other researchers can pose their own questions, things that they may or may not be able to answer themselves, so that the community can start to work on that together. Here are the 3 questions that we started with. One was to see whether we could look for differences between those with and without Parkinson's disease in our study. Then within those with Parkinson's disease, can we build a classifier that's individual to see the effects of medications on how they are performing the activities? And then finally, could we look at differences in the severity of symptoms based on the activities that people are doing within the study? So without diving deep into each of the different streams, I chose to only highlight one of them, and that is for the tapping activity. This asks participants to tap 2 buttons on the screen of the iPhone as quickly as they can, alternating between their first and second digit for 20 seconds. From that simple recording, we've extracted over 40 different statistical features of any performance that somebody's doing. And so here we have nearly 6,000 recordings from over 400 participants with Parkinson's disease when they claim to be off of their medications, and compare that to 6,000 recordings of 443 age-matched controls. So these are people without Parkinson's disease. And using random forest approach, applied or built a model to using those statistical features. And here we highlight the top 5 that came out. So the number of taps that people were able to achieve in 20 seconds was the most important, as shown on the importance plot on the right. This is one way to approach this problem, but there are many others, and we invite the community to start to look at that as well. And all of this work that I'm presenting here was done by Elias Neto, one of the people that was listed on the first slide of this presentation. As I mentioned, we can also look at what's happening to an individual over time. So this plot represents here a 2-day average of the number of taps that a single participant was able to achieve pre and post medication. So red represents a time when the person said, this is before my medication. Blue represents a time when it's after medication. All of this work that we're presenting here has not been published, and in an effort to help the community understand how we're doing with this effort, we feel very comfortable to put this out, but we anticipate that the community will come in with other questions and other approaches to these same issues. In this particular plot, you can see that there are daily fluctuations that occur within the individual on their performance, and we'd like to understand whether we can look deeper across individuals to see these same fluctuations. Now, taking a step beyond just the tapping and looking at the other activities, one which measures walking, one which measures the phonation, and one with balance, we've started to look to see whether we can understand what occurs when one of the participants is taking medications. This is a graphic that represents 36 different participants that gave the most data in those first 6 months of mPower. And so each column represents a single patient. Each of the boxes is colored as a black box if there's a statistical significant difference pre and post medication for a specific statistical measure from tapping, walking, voice, or balance. The gray box represents enough data to make a statistical measure but not to reach significance after multiple test corrections, and white represents not enough data to make the test available. So it should be mentioned that just as Meg was mentioning that all of this is donated by people, none of the tasks are required by participants, and so people can choose to do different activities at different times, which is why there is some data that appears to be missing here. It's just a choice of that particular participant. What you can start to see here, though, is a heterogeneity that is known among clinicians but has heretofore not been able to be measured. We believe that this representation of these different features and these different activities is getting to something that may really be biologically relevant in the course of Parkinson's disease progression and in the heterogeneity between individuals. This, of course, is a hypothesis, and we would love to chat more with those who are interested in this type of question, either Parkinson researchers or big data researchers who would like to approach this problem. Another way to look at the same data is shown here. So these are those same 36 patients. And rather than looking at pre and post medication, we compared these people to age-matched controls for each individual. So again, each column represents a single individual, and the length of the column is is in effect a percentage change from the median of the age-matched controls. So the longer the column, the further away the performance from the age-matched control. So one could say this may get to a sense of severity of the symptoms within each of those activities. What is very striking here is that we've ordered the 36 participants in distance from greatest to smallest of tapping, and that same ordering does not exist when you look at walking, balance, and voice. So even within the different activities, we're starting to see that there's quite a lot of heterogeneity in the signal that we're able to measure in those that perform the activities the most. So we hope that this glimpse into the data and into some of the activity that we've done here with the extraction of features and some of the early analysis will begin a conversation. Brian showed how one can access the data. These features that we've discussed, these statistical measures on each of the activities, we've also processed all of the data that are made available, and those will also be available on the wiki, through the wiki site for people who are qualified. And we would love to host a research discussion with those that are interested in April. And in the meanwhile, we welcome you to contact us at mpowersupport@synapse.org, which is an email address that is also linked on the wiki.
So the things that you've heard over the last 15, 20 minutes hopefully have given you a glimpse into what it is that we're hoping will transpire from here. We're hoping that people will go in, look at the data, make the insights, suggest projects, the availability of something that will be up soon, which is sort of a wall of questions or projects that people can look at, can comment on, should help such that by the next webinar, or at least a Google Hangout or some way of having maybe a more live conversation with people who are interested in this material. We'll hope that gives you something to chew on. And I think in the remaining few minutes, if there is a question or two that's at the top of the stack, maybe we can address those before we go off.
So we see in the chat window that there is a question. Is it possible to perform analyses across task types? And yes, it is very possible. We haven't gotten to that point since there is some need for quality assurance among the different tasks, particularly regarding the timing of the tasks. But that is an important question, and one that we would invite any researchers interested in doing time series analyses with asynchronous tasks to take a look at how best to approach that problem.
I think we'll close here and look for questions that have been captured and answers when you get on the site. And want to thank everyone who joined in today and those who are watching in the future.